Good day everyone, I am Jeka Javier from ESN3F and I am here to discuss and demonstrate the administering of oxygen through nasal cannula. For this procedure, the goal is that the patient exhibits an oxygen saturation level within acceptable parameters. Also, for the equipment needed for this procedure, we have to check for, first, the oxygen delivery device as ordered by the healthcare provider. Second is the oxygen tubing. Consider extension tubing. Third is the humidifier, if indicated. Fourth is the sterile water for humidifier. Fifth is the oxygen source, the oxygen flow meter, and the appropriate room signs. For the implementation, first, we need to bring necessary equipment to the bedside stand or overbed table. Second, we have to perform hand hygiene and put on PPE if indicated. Third, identify the patient. Next is fourth, close curtains around bed and close the door to the room if possible. Next, explain what you are going to do and what is the reason for doing it to the patient. Next, review safety precautions necessary when oxygen is in use. Place a no smoking signs in appropriate areas. Sixth, connect the nasal cannula to oxygen setup with humidification if one is in use. Also, adjust flow rate as ordered. Check that oxygen is flowing out of the prongs. Seventh, place prongs in patient's nostrils. Place tubing over the behind each ear with adjuster comfortably under chin. Alternate the tubing may be placed around the patient's head with the adjuster at the back or base of the head. Place gauze pads at ear beneath the tubing as necessary. 8. Adjust the fit of the cannula as necessary also. Tubing should be snug but not tight against the skin. 9. Encourage the patient to breathe through the nose with the mouth closed. 10. Reassess patient's respiratory status, including respiratory rate, effort, and lung sounds. Note that any signs of respiratory distress such as tachypnea, nasal flaring, use of accessory muscles, or dyspnea. Next, remove PPE if used. Next is to perform hand hygiene. And document the procedure. And lastly, put on clean gloves, remove and clean the cannula. And reassess NARES at least every 8 hours or according to agency recommendations. Next, check NARES for evidence of irrigation or bleeding.